Thomas, maybe we could just start with like introductions to the two of us and like um I suppose, like a quick I kind of want to do a brief introduction and then a rundown of what's happening or who HCAO is and then and then you do the same. And yeah, I think that you probably put together a different like talking points itinerary or like a flow, but I want to start with that kind of introduction. Does that make sense?
Yep.
Sweet. So, yeah, I'm Collin Stackhouse. I'm in the Healthcare for All Oregon Portland office, and this artwork behind us will be auctioned off at a January art auction. So we're pretty excited for that. But yeah, I have been a volunteer with Healthcare for All Oregon for about 4 years and working doing social media and other communications for about 6 months, a little over 6 months now with the organization. And so, yeah, so I'm a paid contractor. Healthcare for All Oregon has existed for 25 years in various iterations. We started sort of in the wake of a Senate bill that didn't go through about 25 years ago for universal healthcare for Oregon. And then some of the core leaders from that group formed this nonprofit, and we have been working trying to get universal healthcare transition starting in Oregon, various ways that we've like been nudging the pathway of our entire state for the last 25 years. But this feels like pedal to the metal with the next few years of action as we kind of finalize a universal healthcare plan for our state. So it's crunch time and a marathon at the same time.
Yeah, so my name's Thomas Kennedy. I have been the social media lead at Whole Washington for about 4 months now, 3 or 4 months. I've been volunteering for 11 or 10 months now. Our organization has been around since 2016. We have been pushing by bill or by ballot for universal health care since that point. We're the largest universal healthcare group in Washington State. We're part of the Healthcare is a Human Right Coalition. We're a 501c4 political nonprofit, unlike Healthcare for Oregon, but we also are adding a 501c3 wing very soon, which is very, very exciting for many reasons, most of which involve fundraising. We're really seeing huge developments in Washington State. We had the most senators ever co-sponsor our bill this year at 11. We had the bill introduced in the House for the first time ever, and this is a full universal health care bill. And we got 17 co-sponsors in the very first year without actually putting in the groundwork to try to get them. We actually found a prime sponsor who went out and got us 17 co-sponsors. So we're really excited to next year to build on that success from this year. We had some huge wins this year, including passing Senate Joint Memorial 8004 in Washington, which put the legislature on the record acknowledging that universal health care is the correct decision to move forward with. We also got a huge Washington State Labor Council resolution passed this year. So if you are part of a union, including huge unions like my old union, the Washington Education Association, which represents teachers, you might see a lot more pro-universal healthcare materials in what you receive from the unions. And so this is a really, really, really exciting time. And on top of all that, the video I just made today, people's increased health plan subsidies are coming in like very hot right now, like 200-300% increases in their what they have to pay for their premiums. And people are just starting to figure this out. October 15th is when open enrollment starts. So right now is like a critical time for protecting people's healthcare access and advocating for healthcare rights.
Yeah. Yeah, it's going to be, I think, even like you and I are plugged in, and probably the people that are watching this live or in the future are interested in this topic, right? But I think there's so many Oregonians and Washingtonians who don't know how bad it's going to get. Like they don't, even though like just like everything in the news, it seems like if you're in it, you're in it. And we're sort of, I'm inundated with news. So I'm aware that prices are going to rise, but I think there's a lot of people who will be surprised or may not even realize until January, even if there's this open enrollment like scenario happening from now until the end of the year. So yeah, I'm curious about your labor. I want to talk about what's happening with labor with our organization. We've been around for 25 years. There's been like peaks and valleys with our engagement. A lot of the original founders of our org 25 years ago were strong union connections and union leaders, and we're mobilizing as many of them as we can for our next Universal Health Plan Governance Board meeting. So it's a board to take a step back, talk about two things at once, which is our labor hopes and also the reality of this board. The Universal Health Plan Governance Board has been created with a Senate bill in our state legislature, and it's this group of 9 individuals that have the obligation to deliver a plan for how Oregon can finance, administer, and transition to a universal health plan, and they're obligated to deliver that plan September 15th, 2026. There has been some previous engagement with unions in this effort. Back between 2019 and 2022, there was some dedicated outreach to labor, but the current board doesn't have that obligation written in the law of their bill. And so it's sort of up to us and up to unions individually to tell the governance board what they would need in a new healthcare system. So the governance board meetings are on the 3rd Thursday of the month. The next meeting is on Thursday, October 16th, and we're trying to activate as many union leaders from around Oregon to come and deliver either written testimony or either give written testimony in advance or pop into the Zoom meeting and speak for a few minutes, or to show up with us in person in Salem, Oregon, and talk to the governance board. So that was it's dense. Do you have any questions about do you have any questions? I don't know. I feel like maybe we can ask questions back and forth to each other about that work. And I'm curious about your labor, your campaign.
Yeah, so our Labor Council campaign is not something that we are doing alone as whole Washington. It's something that really comes about because we have a really strong Healthcare as a Human Right coalition with powerful players that are even bigger organizations than we are, like Washington Community Action Network, like Puget Sound Advocates for Retirement Action, and several others, the Asian Pacific Islander group, forget what it's called, but APAC, that one. So really, a lot of the lifting has come from their connections, along with some of our connections, and our shared values. And when it comes to getting union support, getting union on board, we, as a coalition, are very strongly aligned. And so we had like overwhelming success at the Labor Council this year. It was on July 24th, and about 350 of the represented, of about the 355 represented unions voted yes on this. One abstained, and a few said no, 4. And so that is that makes us feel really, really good. We also had extremely powerful co-sponsors, including the largest union, WEA, and a bunch of other really, really impactful groups. And so we're already seeing, especially with a lot of the nurses unions, that links to our coalition, links to our whole Washington's website are actually being put in their union materials. And so this is going out to union members. More people are figuring out that like the real secret to universal healthcare is it genuinely is cheaper than our system. It genuinely provides better coverage, and it genuinely covers more people. It doesn't seem like that should be possible, but that's why universal healthcare is such a ridiculously amazing thing to advocate for. It feels free. It feels so easy to sell people on.
I mean, yeah, and in the same like vein, there's no way that fact is enough. Like if that fact was enough, then 50 years ago, or maybe even 100 years ago, like we as a nation would have chosen to do the obvious choice of saving money and saving lives and providing better care to more people with less administrative burden. that's also obvious. And so it's our job as these advocate groups to try and get people to feel something, because feelings are what changes behavior, and feelings motivate people's voting. I hear and I'm perceiving in in the last couple of years. Um, yeah, so like I'm glad that the unions are latching onto like the obvious facts, that this will save money, and like help the labor so much by having this taken off of the bargaining table, because it should not be connected to our employment. There should be no difference in the quality of care that people are able to receive based on the kind of job that they have. We think healthcare is a human right, and so do you. So anyway, so the facts are great. I'm glad that unions in Washington and in Oregon are able to comprehend the obvious facts that have been around for generations. Um, yeah, we need to mobilize people to like get mad and engage with both of these groups, or maybe get hopeful, which is why you and I are both here. We're doing this work because there is like a real glimmer of hope, which is crazy to say on days like today, you know.
Yes. And things often get better after they get worse. Like there is a slingshot in the other direction, and right now things are clearly getting worse. There's clearly an impetus at the national level to take away people's healthcare access. And when you take stuff away from people, they get very angry. And so there is a lot more, and when October 15th rolls around, there's going to be a lot more interest in universal healthcare movements, movements that seek to protect these people. Because that's genuinely what brings Collin to this movement, what brings me to this movement, is we want people to have health care. This isn't about me specific. I have health care. My wife and I can afford to pay for my obscenely large medical bills. But not everybody has that ability. And I see my bills come in and I go, what would somebody do if they didn't have the savings account to pay for those bills? And I hear on Reddit from people who are like, I don't know if I'm going to be able to pay rent if I go to the doctor. Like I have to make that choice.
It's like it's like so trying to figure out how to like get people mad and activated, because like everyone, you have a personal healthcare story, I have my own personal healthcare story. Every single one of our volunteers, because we're a volunteer, just like y'all, volunteer-led organization, we all have like tragic stories, like lots of them, tragic personal stories from friends and family and ourselves. And it's like another like metaphor, or like, you know, there's metaphor poisoning, or I don't know if that's a real phrase, but like the idea of an echo chamber. To a degree, we're in an echo chamber right now, but another way that I've tried to think of it is eventually if people are like speaking in an echo chamber loud enough, other people outside can eventually hear. I want to ask Meow Kitty a clarifying question about that the Democrats would not approve the CR. Do you know what that means, Thomas? So to answer your first question about how we make it clear to voters that this impending premium increases are the fault of the Republican policy, we have decided that even this is like a one-on-one conversation to a degree, but our like conversations that we have one-on-one with our volunteers and that the volunteers have with members of their community, like that's how that information gets across. And at the same time, thank you, both our movement and in Washington, like we will need the support of conservative Republican voters, because this is a nonpartisan issue, and it's like a huge ball of snakes. How do you parse out what is how do you begin? Like, do you begin by saying this is exactly the Republicans' fault, trying to get somebody over to your side, or do you begin by saying like overall, my perspective, the Democrats and the Republicans have both built this system that is very poorly functioning, you know? What are your thoughts on that, Thomas?
Yeah, we generally at Whole Washington try to stay political. Now, we clearly come in on the side of healthcare access. So, like for the current government shutdown issue, even myself personally, I know people who are affected on both ends of the government shutdown, like who will have their health care taken away because they can't afford the premiums, and I know people who are losing their jobs temporarily, at least because of the government shutdown. People who are like air traffic controllers or other government officials, and so where we come in as an organization is we just want the healthcare access. We don't really play sides on this Democrats versus Republicans battle. Most of these guys are just playing chess at this national level, and we're not. We're singularly focused on we want people to have healthcare access. This is what we care about. And just like Collin said, even though Washington State has a really strong majority, and there's a decent chance they'll have a super majority in both the House and the Senate after the midterms, because after the midterms, the president's election year, whoever, the party of the president generally loses in midterms. And so we might even go farther that direction. And having said that, most of our hospital closures are happening in Republican districts. Most of the people who are going to be the most affected, our highest Medicaid usage districts, are Republican districts. Like, we need to win over these people too. At some point, these representatives will have to represent their constituency and protect their constituency, and we're just waiting for that ball to drop.
What do you think that ball is going to look like? Meaning, you at some sort of town hall, folks from whole Washington, like, what does that look like when they have to represent their constituency? Whoops.
So I have friends in other nonprofit spaces, like food banks, and they said they have told me that because of the impacts of like SNAP reductions in their districts, they've been more receptive to funneling government money into food banks. And you wouldn't expect that. And they said they've had an easier time with the Republican officials, partly because their districts are more affected than they have with the Democratic officials in their districts. That's a really interesting piece to this whole puzzle. Also, we are running town halls. We're running a town hall this weekend in OMAC. I and other members are involved trying to do outreach. Oh, if you don't know where OMAC is, Collin, it's like in northern Washington.
I like OMAC. I've been there.
All right. I haven't, so
okay, good.
It's on my list of things to do. But Yakima, OMAC, and Moses Lake, and these areas are getting really, really crushed. Prosser, where a lot of the Washington wine is from. These are where hospital closures are. These are where Medicaid unexpansion is really going to affect the most people. And so it's really reaching out to these communities, having these communities put pressure on their elected officials to represent them, to protect them. That's where I see a lot of this, because we're already seeing, I was talking to nurses earlier this week at Washington Council of the Blind, and they said we're already seeing people coming over the pass from those areas, from Moses Lake, from Yakima, from OMAC, to go to the doctor in Issaquah or Seattle, because they can't. There's no doctor there. They're closing wings. They're closing their reproductive wings. They're closing all sorts of services that people now have to drive 2 hours, and blind people can't drive 2 hours. They just can't do that. Oh man, so many comments. Also, writing people with their LD reps and senators about this is important. Yeah, true. Oh yeah, I gotta look at all these comments. Healthcare should be apolitical. Gosh, I agree. I wish it was. I wish I didn't get those comments on YouTube or Reddit explaining to me how I don't understand my own healthcare experience.
Well, and the thing, if that person on the other end of you and I both are on the receiving end of the internet, which is something, what a choice we've made. But if nobody can accurately describe in a social media comment the nuances and the challenges of our burdensome, convoluted, overly complicated, very dysfunctional, broken healthcare system, you know? And so,
Yeah.
of course, and also like us trying to keep our posts to 90 seconds or whatever, like there's no way we can't, it's impossible in this medium to like get any point across. And I will even say, like, even after a conference, like a full day long or several day long conference on this topic, people still walk away like not understanding everything because it's made to be complicated. One of the I have, Thomas, I don't know if you have imaginary arguments in your head with opponents to this, but I do. Um, and one of the imaginary arguments that I'm sort of preparing for are with representatives that are saying that they're advocating for their constituents, but are not for universal health care. And I think one of those phrases that has latched on for me personally, and not exactly like the messaging of our nonprofit, but like the idea of deserving, you know? And so there's people that will say, like, well, I don't want to pay for somebody's healthcare because I don't deserve it, is one of those arguments. And so my question to those representatives would be like, can you explain to me and your constituents why they do not deserve healthcare? Can you say why, what they have done to not deserve it? Because I bet that your constituents are working really, really hard. I bet you that they're burdened by our very burdensome healthcare system. I bet that they've contributed in some small way to helping make America the wealthiest country on the planet in the history of countries. Is that right? I don't know. We're so wealthy, we have the power to pay for this because it's very possible to do, right? So yeah, on the idea of deserving, like trying to, I don't know if this is a great tactic, but it's an idea, trying to have those local representatives explain why they want to keep the most expensive healthcare system on the planet, explain why they're interested in not changing away from this system that harms everyone I've ever spoken to, you know?
Yeah, and another argument I like to use in that case is, what makes you think you aren't paying for those people's healthcare right now? Feel like those people still go to the doctor. They just go to the emergency room when they're like dying, when they're in dire straits, and it costs so much more money. And I made a video recently about I had gone for cortisone shot injections at the doctor, and because it was considered a surgery by my hospital, I was being billed an extra $1,000 for a 10-minute appointment, of which I had to pay $600, which was really, really great. And that's paying for those people who don't have insurance. That's literally what people are complaining about having to do in a universal healthcare system.
I have one more like fantasy, or like this isn't a argument that I've had in my mind, but a fantasy about like why we're focused on this. And then I want to ask more of your thoughts about the Western Health Alliance, because that is like something that I'm stoked for, and I think there's a lot of potential for. But this fantasy that I have is one that I experienced in Spain. Once I had an emergency in Spain when I was traveling there, and I was able to go to the emergency room, get treatment, and walk out and know that there were like no further bills coming. Like the small fee that I had to pay as an out of country resident was like less than $10, and I paid it, and there was no like thought about future fees. And I don't really want there to be a fee, any sort of payment exchange at our hospitals and clinics, because we advocate for a system where there's no more cost at the point of care, because everything's already been paid for because it's a service. So, but this fantasy of going to a treatment, whether it's your primary care doctor or emergency care or a specialist, and you walk out and you know that you're done. Like you finish your cancer treatment or whatever, and you can walk out of the clinic and know that there's nothing, there will be no more surprises, and you have completed the task, which is to get better. So someday.
Yeah. No, I'm horrified. Every time I go to the doctor, I'm like, am I going to get a bill in a month that's for $500, $600, $700, $800? I just have no clue. And nobody tells it. Healthcare is the only industry in the United States where you go and you don't know how much it costs. They
Right.
sell you a service without telling you. It's
Right.
totally terrifying. And if you don't think that encourages people not to get care, you're crazy.
Right. Yeah,
I
that's actually
turned
not.
down care because I knew how much it would cost.
Yeah. Oh, what have you seen, Thomas, with the Western Health Alliance in the last couple weeks? It seemed like at the beginning of September it was like a big, like "Bah, bah, 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 we've announced this thing." It seems like it's easier for Oregonians to get access to our COVID shots, and I haven't done that yet, but it's at the top of my pretty high on my list of things that I need to do to take care of my care. Um, what have you seen on your end?
Yeah, not much since the governor's announcement. The governor seems to have switched over to our governor has switched over to talking more about the number of people who are going to lose coverage. And what's interesting about what our governor has done recently is he's actually lowballing the amount of people who are going to lose coverage,
Hmm.
uh, even from his previous statements. And that's even as the premium increases are being adjusted upwards. And like, for instance, in our state, United Healthcare got approved for a 38% premium increase. Like, where is inflation this high? I think the standard inflation rate is like 5% for consumers. It's like 7% or something right now. And then what, 38? Are you kidding? And this is all related to we're still paying for people, all those people who lose that Medicaid, we're still paying for them. That's what the increased premium's doing. It
Yeah.
sucks.
Wow, I'm seeing that an average 21% rate increase approved for Washington. Um, Bonkers. I don't know. I don't know if we have. I haven't heard that anything comparable for Oregon, but I'm sure that I'm not sure. Yeah, I don't know.
Yeah, we're hearing horrifying stories like all over the place. We're hearing that some of the people, or some of the organizations rather, that serve our ACA expansion people, so the people who are on Apple Health here in Washington,
Mhm.
uh, they might be leaving Washington, some of them,
Mm.
like not practicing in the state anymore. We've heard things with Kaiser stopped accepting Medicaid last year in Washington. We heard that they're going to be restructuring their Medicaid Advantage and discouraging people from getting on it. Here in Washington, there are some really terrifying signals coming, and I just October 15th is going to be crazy.
Yeah, yeah, it's going to be busy. Um,
Yeah.
I want to talk. I guess I want to mention in this. Why not? Because we're just having a conversation, but two um, stepping stones that we feel are important in Oregon, or two like realities, legislative realities that have happened in the last couple of years that we think make us pretty well positioned for this potential universal healthcare transition, in addition to the bill that created the Universal Health Plan Governance Board, which has this obligation to deliver their transition plan in about a year. Um, Before they were developed in 2022, this measure called Measure 111 passed for our state. Sidebar, let's talk about um, constitutional amendments, because this measure was a constitutional amendment that guarantees healthcare as a fundamental right for every person in Oregon. And as far as we know, we are the only state with that bold or that descriptive kind of language in our state constitution, saying that healthcare is a right of the people that are in the state. So that's one stepping stone that we perceive that can get us closer to there. And another thing that's pretty robust in Oregon, from what I understand, and again, not a scholar that can compare Washington versus Oregon legislation, but that's why we're just having a conversation. Last year, we passed Senate Bill 951. Oh, excuse me, it was earlier this like May. Our Oregon Senate Bill 951 is described as the corporate ownership of corporate practice of medicine bill, even though it limits the corporate practice of medicine. It basically says that if I believe it, if an entity is providing care in Oregon, the ownership, like 51% of the ownership of that organization needs to be a physician or not a private equity company, right? I believe they can still like have some sort of a stake, but they cannot have a controlling percentage of the ownership of these clinics. They also, it limits the power of their non-compete agreements, meaning like physicians, if they worked for previously, if they worked for a clinic in Oregon and they quit, they couldn't work within like a 50, 100-mile radius, depending on the contract, for like several years after they quit. So it limits that sort of unnecessary restriction and also lets providers discuss openly some of the problems that they saw. There's a third component of this corporate practice of medicine bill. Private equity companies, like for-profit companies, no longer can meddle in the kind of prescriptive care that clinics or whatever other providers are giving. So there was a time in Oregon recently, this year and last year, when private equity companies or other owners of clinics could dictate the kind of care that was given to try to cut costs, save, and rake in money, and that is no longer allowed. So yeah, those kind of companies can now no longer in Oregon dictate the kind of care that people get. So that's cool. We're excited.
So a few things you said I wanted to hit on.
Please.
First, I'm super jealous of the constitutional amendment. We are currently talking to the senator who is the sponsor of our bill in the Senate, Bob Hoskowa, about bills that we could pass in the near future. And a constitutional amendment is one of the ones I'm most excited about. I think matching Oregon on that front would be really powerful, especially judicially, for protection if we were to actually pass the universal healthcare bill we have. Having that enshrined, it's made a huge deal in Washington recently. Education has that enshrinement that Oregon has for healthcare in Washington, and because of that, I went from making $55,000 a year to making $100,000 a year over like 3 years. As a teacher, that was a huge deal for me, and it was all because of that constitutional amendment. So I think that's an awesome step you all have taken, and really would like to replicate that here in Washington if we can.
Cool. Yeah.
Did you get Republicans on that?
I doubt it. Let me.
I was curious.
I can find out. I'll look it up right now. That measure, I was a volunteer on that ballot initiative back in 2022, and so I did some of that campaign's social media as a volunteer. They only had one campaign manager, and I thought that it was going to be a landslide, and it was not. That constitutional amendment passed with only 51% of Oregon voters voting yes for it, which is really close. I think part of the reason, I remember doing one little debrief after the campaign was over, and one of the reasons why is that it didn't do anything. It just changed the wording of our constitution, so it gave this obligation of the state, but no mechanism to fulfill that obligation. But that is the work of the current Universal Health Plan Governance Board. They will complete the obligation that we have now given ourselves to have healthcare as a fundamental right for every person in the state. Currently, and as we talked about, with the ACA subsidies expiring, cuts to Medicaid, last year at this time, we had about 97% of Oregon covered. And so that's going to change, I believe, pretty dramatically in the next couple of years. Hopefully, our mandate for care, we can lean into the Universal Health Plan Governance Board to keep fulfilling it. So,
yeah, I estimates are 10 to 13% of our population will be uninsured if things go through the way they are, with about half the people being priced out and about half of the increased number of uninsured just losing because of work requirements or the other restrictions. So yeah, it's pretty horrifying to see that, and I'm curious to see, assuming yeah, y'all are going to pass your bill in 2026, 7, whenever it is going to happen. And
Certainly.
then when you all get it, it's going to look so good to Washingtonians that they're going to jump on the train here very fast. And yeah. I've always seen it as us getting it very quickly together. You watch what happened in Saskatchewan, in Canada, and it took 7 years to go from one province to all the provinces
Totally.
having their own system. Like this is an attractive thing.
It is clearly attractive. I want to read. You asked if there were any Republicans that signed on to Measure 111, and I'm looking at Ballotopedia, and I have a quote from the Senate Minority Leader Fred Girod, a Republican who voted against the bill, and this is his quote from 2022 about our constitutional amendment. This bill promises something that Democrats know they can't deliver. The bill doesn't fund any system to deliver on that promise. If Democrats are serious about giving Oregonians free healthcare, they should come up with an actual plan. This kind of lazy policymaking lacks important details Oregon voters need to make an informed decision at the ballot. Well, guess what, Fred? The current governance board is going to give you an actual plan.
Oh yeah, no, that whenever somebody says, in Reddit comments like, no, they don't have a plan. There are no details. You just link the bill, and then they don't want to read the whole bill. They just want there not to be a plan.
Yeah.
They stop. But there's a comment. Pam said, my biggest fear is my son losing his health care. He's on Apple Healthcare in Washington. Oh man, do I agree. My little brother is on Molina, and he has a lot of health challenges and mental and physical health challenges that have kept him out of the workplace, and he's going to drop off. Work requirements are going to kick him out instantly if auto renewal expirations don't do it before that. So I am also terrified. My middle brother currently, I think he works and volunteers enough, but he's like right at the threshold for that because he has not been able to find something with his degree in urban planning. So I know who my brothers are, and they deserve health care just as much as I do. It feels obvious to me.
Yeah, it is obvious, and also there's so much. I'm glad to be a person in this field, in this space right now, like focused on it, and I'm glad that we have a growing group of volunteers and like people that are interested in this idea. But there's a lot of other white noise, and it's all part of the same. It's all part of the somehow it's all connected. It's hard to like stay focused on this thing when there's so much else happening in the world. But that's what we're doing. So
yeah, and people like Collin and I get botted fairly frequently. The bots, especially on YouTube for me, man, the bots are coming hot. Like, yeah, talking with very broken, very Russian inflection to how they type. That our system is so terrible, and so there are clearly moneyed interests against us, and there are clear no bots. Yeah.
Thanks, Wilhelm. Yeah, we agree.
I wish there were no bots, but it's easy to identify the bots, and it's easy to ignore the bots, and just say thank you for boosting my content with your comment.
Yeah.
But yeah, there's a lot of white noise against us, and there's a narrative from the insurance industry that has been really pervasive that when you sit down and talk to people, Republican or Democrat, people often start saying, I have insurance, the system's working for me. And when you start talking about the details, all of a sudden they're like, oh my gosh, this is terrible. It doesn't matter somebody's political leanings. Like, my wife's family is pretty right-leaning, and I can talk to them about this, and they're like, yeah, it would be easier if everybody had health care, if I didn't have to pay at the doctor, if long-term care was something that was provided. Washington, to those who are here who don't know, Washington updated their long-term care policy And it's much, much better. If you move in and out of the state, you can still qualify for long-term care. It has some restrictions and stuff, but Washington actually has one of the best long-term care policies in the nation now. It is so much better than when it originally passed.
I'm looking at you're saying that there's comments on YouTube. I honestly have stayed away from YouTube, and yeah, people don't like what I have to say. What we have to say. Oh well.
Yeah, in the interim, could a general ban on certain medical debt collection practices be passed? Yes. Yes, is the answer to that. In Washington State, we passed a bill, I believe it was this year. Somebody here might be able to verify. I think Catherine was here. But I believe there was a bill passed this year that came from our coalition that doesn't allow medical debt to show up on your credit rating, which is a very big deal because that means you can get medical debt and you can just ignore it when it comes to your credit rating. So that is a way of delegitimizing medical debt. New York banned hospitals from suing patients under 400 the federal poverty line. Oh, good job, New York. New York is awesome, by the way. New York is one of those states that will be one of the early dominoes to fall, which is, oh, Pam says I'm correct. Yes. New York, California, and Vermont are the only three states that have had a majority in the House and Senate be in favor of universal health care at any given time. Unfortunately, in New York and California, it has not happened at the time of voting, which says a lot about some of those people in those the senators in those states. But they are so close. I don't think you can just ignore it. It just doesn't show up on your credit record. Yes, you can kind of just ignore it. You can't completely ignore it. It doesn't affect your ability to buy a house. It doesn't affect your ability to get an apartment. For those pieces, it's very, very helpful. Other debt collection practices are still legal? Yeah. So this is something that actually comes up in our coalition all the time, which is a really interesting thing we talk about, which is, do we try to keep putting Band-Aids on our current system, or do we try to go for the big fix? And at Whole Washington and at Healthcare for All Oregon, we're the big fix people. We want this to happen as soon as possible, and we want to just get rid of all medical debt as soon as possible. We just ran an undo medical debt campaign here, so it just expired. I don't know if Healthcare for All Oregon has ever been involved with them, but you can just buy out old medical debt for like pennies on the dollar because they just think they're never going to get the money back. And so
we've never done that or even really discussed it. Can you talk more about that campaign? So did Whole Washington buy some medical debt or work with people to what was that? What did that look like?
Yeah, undo medical debt, they collect these like really unlikely to be paid off medical debt portfolios, say, collections of these. And you can pay for, you can collect donations that go to paying for these this medical debt to just erase it from the record, to get it off these people's names who are never going to have the ability to pay for it. So it's a pretty cool organization. They it takes a while to collect all of this, so they don't always have something available, and they like to get involved with organizations that can raise that money. So it's an interesting, I don't know what states they service exactly. I know Catherine's here and she probably knows, but Washington's one of them. So yeah, and I agree that New York law sounds awesome. It's just at Whole Washington, that's not our focus. Other members of our coalition, particularly Healthcare for All Washington, would be much more interested in giving their resources towards incremental solutions, things that fix our current system. So there are organizations that are interested in pushing for this sort of thing. We're just a big fix organization. They have to purchase the debt first. Yeah, exactly.
Wilbo, that's a big, hard question. So, I can speak to what's happening on the Oregon side. So we have a group in our legislature that was created with the Senate bill called the Universal Health Plan Governance Board. And they have a subcommittee called the Finance and Revenue Subcommittee that's working on how we're going to finance our universal healthcare system for every person in the state. It'll include Medicare and Medicaid dollars as best we can get them, I guess. And likely funded by a payroll tax as well, or a premium. So calling it a premium because it will take the place of the premiums that people are currently paying to their private insurance companies. So, but like the big question mark is like the ever increasing cost of healthcare. If we are the first state to do this, will be the first state that is like now negotiating with those prescription drug companies, negotiating with these big pharmaceutical companies, et cetera, about the prices and sort of limiting what they can charge, because it would be a baseline. If it's like there'd be some discrepancy on like compensation in urban versus rural areas, like depending on the market or whatever, like they decide. But overall, like the state would now would control the prices that physicians would be, or like providers would be compensated. So taking another step back to YouTube, thinking about comments, looking at this thing that posted today. There's a lot of comments about how bad it is in Canada. One of our board members, the Healthcare for All Oregon board members, is a public health professor at Pacific University in Forest Grove. And she was saying that out of all the countries that do have a universal healthcare system, Canada does it the worst because they are limited in how much money they can actually get. I guess they're limited to 10%, from what I understand, 10% of GDP or some sort of limitation. And that has led to a lot of their problems administering their universal healthcare plan. So I don't know, Bo, how we're going to deal with the ever-increasing cost of healthcare, but we don't want to replicate Canada's problems. We don't want to be limited, and we don't want to let for-profit pharmaceutical companies continue to control us. That's my take.
Yeah, and to add a little bit, Canada has way too few doctors. That's one of the biggest problems with their system, and that's an artifact of being only able to spend this much money. They can only pay their doctors so much, and so fewer people are going into the profession than what they need. So besides that, Canada's system's great, but that lack of doctors and the funding issue is really the thing that's short. Now, in the US, we spend 17% of our GDP on healthcare, 17.6, and that is, we're already paying like plenty. If we lowered that to 15, we could still have universal healthcare for everyone in the United States. And so that's not really an issue. I wanted to go up to the question again. Okay, so yeah, the balanced budget requirements. We also are doing a payroll tax led initiative to replace the premium on both the employer and the employee, just like what Collin was describing Oregon doing. And this is what most other states have done. This is what Colorado's initiative was going for. This is what I believe this is also the way that California's was being voted for. Yeah, we're paying for universal health care without getting it. That is exactly right. We're actually paying for worse than universal health care. Like, it's so enraging when you look at the percentage that we waste on administration in the United States. Like, I showed the slide in our town halls, but it's like 5x the average comparable country what we spend on administration and healthcare. That's middle managers. That's just a waste of time. There's nothing going on there. And so, yeah, the savings come from eliminating that entire parasitic industry. I made a video about comparing it to the tax prep industry because it's so similar to TurboTax. TurboTax doesn't need to exist. You can just go to irs.gov and do everything. If TurboTax hadn't lobbied and made Congress protect their place in the industry, IRS was willing to do this like 20 years ago. But the IRS is the demon here. They're the bad guys. You got to go to Costco and buy your $50, $60 yearly TurboTax subscription for nothing. And that's what healthcare is. It doesn't need to exist. Healthcare insurance, the whole insurance industry, it just doesn't do anything. It's like mosquitoes. Like nobody likes it. Doesn't do anything.
There's a lot of like the writing is on the wall for so many things, or at least that's what I see. Wilbo, certainly. Yes. So ERISA is the Employee Retirement Insurance Services Act from 1970, whatever. And so, yeah, totally. We in Oregon are expecting, they're trying to write their final plan. They've known about this. They've known about the ERISA potential exemption needed or the potential ERISA lawsuits for a couple of years. So, yes, and I'm glad that people smarter than me are preparing for it.
A few things on that. Hawaii, part of the reason why Hawaii isn't going to be crushed by the Medicaid cuts like our state, like Oregon, is because they have an ERISA waiver. These exist. You can get waivers from ERISA. And in an ideal world, if we were to implement universal health care, getting an ERISA waiver would make it so much easier. Now, we're not in a world where that's possible at the moment. However, what we do have is the Healthy San Francisco model, which was held up in courts, and we have copied that model of dealing with ERISA. In other words, we don't ban private insurance. We don't mandate that employers use the state plan. We're just going to make the state plan better than all the other plans. You can still do the private insurance, but you won't. That's how we're getting around ERISA, and that is modeled on something that has succeeded, right? But didn't they get their law frozen? I think there was something frozen with that, but it did get upheld. I don't remember the exact. Wish Andre was here or somebody.
Yes.
No one will pay for that.
I don't know what you mean.
No one will pay for the private insurance plans? I agree.
Oh, yes. Yeah, so one of the ways that I heard it described when the Oregon's Joint Task Force on Universal Healthcare was working on their plan between 2019 and 2022 is that like one of the ways to sort of dodge the ERISA problem and triggering an ERISA lawsuit is to like write all the language just like kind of around the idea that there is employer provided healthcare at all. So like I don't know if this is still part of the plan. Knock on wood, we should have our first draft of the Oregon Universal Health Plan by February of next year, which is great because the final plan must be due in September. So that's like a little less than 6 months to like, or about 6 months to get it done. But yeah, something I heard up until 2022 was the idea of writing the final plan, the final proposal of the bill, without even mentioning employer provided insurance, which seems close to impossible.
Yeah, ERISA sucks. It's a bad law. I agreed.
Yeah.
I wish it was the only one, but you know, like Citizens United is like a really good law. Really, if it were, you know, I guess it's more of a ruling, but what it allows is just unhelpful for cases like ours. Something that's good for almost everybody, but a few moneyed groups can jam up with no. They're making plans around it. Yes, the plans around Citizens United, I'm really excited about that. I don't know how much traction it's going to get, but I've seen a lot about that. Apparently some guy made a YouTube video and they're pushing for it in Montana, and now a whole bunch of other conservative states like Alaska and Idaho and stuff have glommed onto this. I really hope that those are judicially successful.
I have not heard about that, but that's great. Yeah.
Yeah, thanks for bringing that up, Wilbur. That's some interesting stuff to round off our call because we are getting close to an hour here.
Yeah, we could talk for many more hours because we're both angry. Yeah.
My mom's generic blood thinner is $670 for a 90-day supply in the US, and it's $48 in Canada. How is that not a crime? Do we blame the big pharma lobbyists in DC? Yes, you do. Yep, that's right. And part of what Collin was talking about, with Oregon being a big state entity, if Washington and Oregon were together as both had universal health care plans and were going for plans together, and maybe we're doing it with New York, we could really push down those prices because we'd have huge leverage with all those states involved. If California was involved,
Right.
California determines everything in education. It's California and Texas. Those are the two textbooks. You pick one of
Well,
them.
homeboy, Governor Newsom, bless his heart, he said that he supports universal health care in one of his many tweets. But now, okay, so he's like mimicking our president, who says a lot of things that don't come to pass or don't mean anything. So hopefully Gavin Newsom will continue to support universal health care. But my understanding about what happened in California is that did he play a role in sort of like the downfall of their most recent plan? Can you speak to that, Thomas?
As far as I understand it from the research I've done, people came to the prime sponsor at the time and said, I know I said I'd vote for this, but now that it's going to pass, I really don't want to vote for it because then I'll lose my money and I got to run for office in 3 months. And that's what really killed their plan. And yeah, it's very frustrating. Let's get money out of politics. Let's stop the biggest skill being either being independently wealthy or being able to fundraise for leading. Let's have leaders who are good at leading instead of fundraising. That would be really, really cool.
Yeah, I think I'm glad to be here. Social media is a hellscape, and it's nice to be waging through. What's that river? Not what's the river in Styx with you, Thomas?
Likewise.
Yeah.
I really appreciate all the work you do over at Healthcare for All Oregon. If I got better at Instagram, I would get better at reposting your things, but I'm still not there yet.
Whatever.
We can live stream on another platform maybe next time.
Let's
See how
try
that works.
TikTok. I've never done YouTube, but yeah, let's do something in a couple weeks. That sounds great.
All right, sounds good.
All right.
And thank you everyone for showing up. You guys rule. And direct democracy in Oregon and Washington, let's go. Let's go. Oregon and Washington are going to be the leaders here.
Yeah, there's no choice. Nobody else is, I guess. So,
yeah.
I'm gonna wait for you to hang up. I don't know how to stop this.
Yeah, me neither. I didn't know how to. More people wanted to like talk in this, and then I didn't know how to invite them. So, oops.
Whatever.
We'll get them next time.
Thanks, Thomas. Thanks, everyone.
All right. Thank you.